Welcome on the Herbal Bloom. Cold and flu season is the subject today, and natural wellness culture often begins with herbs. Dr. Sebi-associated teachings emphasize plant foods, herbs, teas, and ideas about cleansing the body. Those practices can create comforting routines, but they do not replace the prevention tools with the strongest evidence for respiratory viruses. CDC guidance focuses on staying up to date with recommended vaccination, practicing hygiene, improving cleaner air and ventilation, and staying home and away from others when you are sick. Those steps are less glamorous than an immune tea, but they address how infections spread and how severe illness can be reduced. This video gives you 7 habits. Some are medical or public health measures. Others are basic lifestyle foundations that help you care for yourself during a demanding season. The important distinction is this: supporting general health is not the same as making yourself infection-proof. No food, herb, tea, or alkaline diet can guarantee that you will not catch influenza, COVID-19, RSV, or a common cold. If you become ill, some infections have specific testing or treatment options. Influenza antivirals, for example, may be appropriate for some people and work best when started promptly. Natural remedies should never delay care when symptoms are severe or you are at higher risk. Habit 1 is recommended vaccination. CDC describes vaccination as the most effective tool for preventing severe respiratory illness. Which vaccines are appropriate depends on age, health conditions, pregnancy, prior vaccination, and current recommendations, so use a clinician or pharmacist for individualized guidance. Habit 2 is cleaner air. Ventilation, outdoor air, filtration, and avoiding poorly ventilated crowded spaces when respiratory illness is circulating can reduce exposure. Habit 3 is hand hygiene and cough etiquette. Wash hands regularly, cover coughs and sneezes, and clean commonly touched surfaces when appropriate. Habit 4 is staying home when you are sick. A wellness culture focused only on personal immunity can forget that protecting other people matters too. These first 4 habits may not look like Dr. Sebi content, but they matter more for preventing respiratory infection than a special tea. A warm herbal beverage can still be part of the routine. It may provide fluid, warmth, and comfort, but it should sit after the prevention basics, not replace them. If a family member is medically vulnerable, prevention deserves even more attention. Ask a healthcare professional about vaccination, antiviral plans, and what symptoms should trigger rapid evaluation. Habit 5 is adequate sleep. Sleep does not create an invisible shield, but chronic sleep deprivation can make the entire season harder. Keep a regular schedule when possible, reduce late caffeine, and protect enough time in bed. Habit 6 is consistent nutrition. A plant-centered diet with vegetables, fruit, whole grains, nuts, seeds, and adequate protein can support normal nutritional status. That does not mean a particular alkaline food prevents infection. The strict Dr. Sebi diet can be nutritionally restrictive. If followed long-term, it requires planning for vitamin B12 and other nutrients. During illness season, under-eating in the name of cleansing is especially unhelpful. Habit 7 is normal hydration. Drink according to thirst, activity, climate, fever, and medical guidance. Warm tea or broth can be pleasant. Do not force huge amounts of water because a wellness post says you need to flush a virus. Garlic, ginger, elderberry, echinacea, and many other remedies are promoted for immunity or colds. Evidence differs by product and condition, and supplements can interact with medicines. NCCIH notes that very little research supports garlic as an immune booster for cold and flu prevention. The safest approach is to treat herbs as optional additions rather than the foundation of prevention. Now build a cold season home routine. Keep soap and hand washing easy. Improve ventilation when practical. Know where your thermometer and basic medical information are. Keep simple foods available for days when appetite or energy is lower. Choose 1 or 2 food-grade herbal teas you already tolerate rather than buying an entire immune cabinet. Keep water, fruit, grains, vegetables, and easy meals in the house. If someone becomes sick, reduce close contact when possible, follow current public health guidance, and consider testing based on symptoms and circulating illnesses. People at higher risk should contact a clinician early because treatments may be time-sensitive. Know the red flags. Trouble breathing, chest pain, confusion, severe dehydration, fainting, blue or gray lips, or rapid worsening of symptoms require urgent medical attention. High-risk people should seek guidance sooner. Do not use the language of detoxification to explain fever, mucus, sweating, vomiting, or diarrhea. Those symptoms have physiological causes and can sometimes become dangerous. A natural routine should make illness management calmer and safer. It should never persuade someone to stay home with a serious infection because they believe the body is simply cleansing. The 7 habits are straightforward. Vaccination when recommended, cleaner air, hand hygiene, staying home when sick, adequate sleep, adequate nutrition, and sensible hydration. You can add tea, herbs, warm meals, and quiet rituals around those foundations. That preserves the part of natural wellness that feels nurturing without replacing the tools that actually reduce risk. Create a small seasonal checklist before anyone gets sick. Know where the home tests or thermometer are. Know which clinician to call and keep easy food in the house. Prevention works better when decisions do not begin in the middle of a fever. This episode is educational and not a diagnosis or treatment plan. Respiratory infections can become serious, and specific treatments may be appropriate depending on illness, timing, age, pregnancy, and medical history. The Dr. Sebi-inspired part of the routine is the interest in simple plant foods and herbal beverages. The evidence-aware part is refusing to call them vaccines, antivirals, antibiotics, or cures. Cold season is not one with one ingredient. It is managed through layers of protection and good judgment. Keep the tea if you enjoy it. Keep the vegetables. Keep the simple meals. And keep prevention grounded in how infections actually spread. Subscribe to the Herbal Bloom. Another layer of prevention is planning for the household before the season becomes busy. Check which family members have chronic lung disease, heart disease, pregnancy, immune suppression, or other conditions that increase risk. Make sure they know whom to call and what treatment plan applies to them. This is especially important because some antiviral treatments are time-sensitive. Keep masks available for situations where an extra layer of protection makes sense, especially around vulnerable people or crowded indoor settings during periods of high respiratory activity. Cleaner air and reducing close exposure can work together. If you choose herbal products, review them before anyone gets sick. A complicated supplement list is much harder to evaluate in the middle of an illness. Keep labels and avoid assuming that a product marketed for immunity is automatically compatible with prescription medicines. Prevention is strongest when it is prepared in advance. The goal is not fear, it is fewer last-minute decisions. Before changing several habits at once, choose 1 or 2 variables you can actually observe. Keep a short note of timing, symptoms, meals, beverages, sleep, and any new herbal product. That simple record makes patterns easier to see and makes a conversation with a clinician or pharmacist more useful. Avoid adding several supplements at the same time, because both benefits and side effects become harder to interpret. A slower experiment is often safer, cheaper, and more informative than a dramatic reset.